Hi, we will talk about kind of a cluster of disease conditions which include acidity, gastritis, and GERD, that is gastroesophageal reflux disorder. Now, these conditions are very common. 20 to 40% of the world population suffers with these gastrointestinal symptoms, and a huge amount of medications are being taken over the counter for these conditions. We'll talk about the scope and the prognosis of homeopathy in the treatment of these conditions, as I mentioned, gastritis, acidity, and GERD. My name is Dr. Rajesh Shah. I'm a director of Life Force, where we treat patients of all chronic and recurring diseases from practically every part of the world, currently over 182 countries. Based on our experience in the treatment of around 1200 plus cases of GERD, gastritis, and acidity, I'll give some thoughts on the scope of homeopathy for these conditions. Homeopathy is strongly recommended for these diseases, which are largely induced by stress, lifestyle changes, or sometimes drug induced. And homeopathy medicine can definitely alleviate the symptoms by treating the cause, the etiology behind that. Sometimes gastritis is induced by not only stress or lifestyle, but also by certain drugs, certain medicines which are known to produce gastritis, and one has to also treat the conditions for which one might be taking painkillers or certain other medicines which produce gastritis. So the treatment of gastritis may also entail treatment of some other conditions for which one might be taking the drugs or medicines. And once you reduce those medicines and also give homeopathy, one can get improvement in the symptoms of gastritis or acidity. Homeopathy is strongly recommended. The duration of this treatment again varies from patient to patient depending on the factors influencing this disease and its maintenance. But look at something like 6 to 8 months. If it is very acute and short duration, then maybe within a few weeks' time, one may experience significant improvement. In very chronic cases of gastritis, one may have to take the medicine longer, maybe close to 1 year or even longer. Also, it is important to know that sometimes there may be some physical problem in the cases of GERD. For example, the wall may have certain defect and that may become a mechanical problem, or one may have hiatus hernia that also is mechanical. And in these cases, homeopathic medicines cannot reverse those pathologies but could only alleviate or give relief in the symptoms and may not reverse the pathology of the disease. So depending on the case, one has to evaluate, one has to investigate the cases, and based on that, the prognosis could be decided best by the attending physician. I hope this small video helps the patients suffering with gastritis, acidity, or GERD, as well as it will help the homeopaths, other doctors, and the medical students and the general public. Thank you so much for watching.